The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Amy Klickner, the CEO of the Lake Superior Community Partnership, and welcome to today's webinar, Health in Your Business. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You're listening and using the computer speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit questions to today's presenters by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect them and address them during the Q&A session once the panelists have completed their presentations. And now I would like to introduce Gar Atchison, the CEO of UP Health Systems Marquette and the market president for Health System Bell, Marquette, and Portage. Gar has been with the UP Health System since December of 2019. He is a seasoned leader who is deeply committed to UP Health System's mission of making communities healthier. A veteran healthcare executive with more than 30 years of experience, Gar joins UP Health Systems Marquette from Fry Regional Medical Center, another Duke LifePoint facility in Hickory, North Carolina. During his tenure there, he served in several leadership positions, including Chief Operating Officer, Vice President of Business Development, and Market Operations Director for the hospital's physician network before assuming the role of CEO in 2016. Prior to his time at Fry Medical Center, Gar served as CEO of Hickory Orthopedic Center, practice administrator for Bay Street Orthopedics in Petoskey, Michigan, and financial operations manager for Northern Michigan Hospital, also in Petoskey. Today, Gar will be speaking on UP Health System safety protocols and a general update of the hospital. Thanks for being here, Gar, and it's so wonderful to have you back as a Michigander these days. I'm going to turn it right over to you.
All right, thank you, and thank you for asking me to participate today. Can you go? Yeah, thank you. So it's a pleasure to be here, pleasure to be able to share some of the things we're doing here at UPHS Marquette and some of our future plans as we move forward with the COVID pandemic. You can go to the next slide. First of all, I'd be remiss if I didn't take a moment to recognize and thank the community for their really amazing and uplifting support of our staff as they have worked through this COVID pandemic, such that it was in the UP, on a daily basis. We're just reminded of how great our community is. So I want to take a moment to forward us time. One of the important messages that I think needs to get out is really knowing where to go. Throughout this pandemic on a national and a local level, we've seen a definite uptick in people who are putting off really health emergencies, afraid to call 911, having heart attacks and strokes, and not going to the emergency room. So I think it's very important that the message gets out that the hospitals are open, the hospitals are safe, and that people should not hesitate to call 911 during an emergency. We need to protect everyone's lives during this crisis. Next slide, please. So it is safe to come to our hospital and all the hospitals in the Upper Peninsula. As you know, in the UP, we've had relatively low prevalence of the disease, but we have implemented always a high standard of clean and disinfecting. Certainly have taken that to a whole new sense of awareness. And we spend many hours with very dedicated and talented environmental service staff cleaning every surface throughout the facility, just constantly to make sure that the facility is clean and it is safe. It's also important to know that throughout this, we have segregated COVID positive and COVID suspect patients to a single unit on a single floor in the hospital, so that the other floors throughout the facility have never seen a COVID positive or COVID suspect patient throughout this event. as we start to slowly ramp up to start meeting the needs of our citizens that have put off some important time-sensitive medical care, we're not booking to our full capacity. We're very methodically and slowly going through the process of slowly ramping up those procedures which need to be done first and have the most impact on the health of the community. We still have a zero visitor restriction policy in place with a few minor exceptions. Obviously, adults of minors or end-of-life circumstances, we do allow restricted visitation. This is not necessarily all that popular. We're reminded almost daily by some visitors that this is not a popular decision, and I think I just want to remind everybody that it's the right thing to do to protect the employees here and to protect the patients here and to protect the community at large. But it is also one of Governor Whitmer's executive orders that declared that no healthcare facility in the state could have visitors. Within the facility, we put a lot of things in place to sort of force social distancing, removing chairs in the cafeteria, chairs in the waiting room areas, and just generally have spread the staff out as best that we can. Of course, it's not 100% possible, but we're doing all we can around social distancing. Next, please. So COVID-19, what are we doing here to protect the staff, the patients, and the community? So we've had implemented since the beginning of this strict screening guidelines for everybody who enters the building, be it an employee, a physician, a vendor, and now more patients. That patients are tested or screened every day for symptoms when they enter the facility, including having their temperature taken. We've restricted entry points into the facility down to just a few, with the employees having only 2 door options to use coming through, where they have their badge scanned so that we know that they're actually been in the facility and have been screened before entering the workforce. Masking, all employees, patients, visitors, vendors, whoever enters the facility must wear a mask at all times as soon as they enter the property till they leave the property and the entire day while they're at work. Certainly want to thank some of the community members, including Masks from Marquette, that really helped facilitate for the non-clinical areas being able to have masks to wear throughout the facility, so we could save the surgical masks and N95s and others actually for the clinical areas that are treating patients. Next slide, please. I did already mention visitor restrictions, so I won't spend a lot of time here, but one of the things we wanted to point out that I will say this picture was taken before we actually had the masking policy, but one of the things I want to point out is that while we have no visitors, and it is a difficult time for families not being able to stay in touch with their loved ones, we have put a lot of things in place. Of course, a lot of people have smartphones, ability to do FaceTime or phone calls. For those patients that don't have that, we have a lot of iPads on carts that we can take into the patient's room and connect them to their family members so that they can stay in touch, because that's an important part of the healing process. Information being given out, it's always a tricky thing under the federal HIPAA laws of who we can share information with. So a family member by the patient or a power of attorney is given a PIN number unique to that patient, so that we know that we're safe to communicate to that family member. Next slide, please. So one of the things that's really been amazing, and everybody in the Upper Peninsula should be very proud of the UP, is the level of collaboration between all of the hospitals that make up Region 8 and the State Emergency Management System, which would include all of the counties in the Upper Peninsula. Really, from the very beginning of this, we've been having weekly phone calls with with the CEOs, myself and all the other CEOs throughout the UP, discussing patients that they might have that, early on were going to be coming our way, or anybody who had PPE needs, and just sharing thoughts and ideas around how we deal with this COVID pandemic. We had agreements in place with all the hospitals where they would, if patient needed critical care, they would transfer them to Marquette. And not knowing what the surge would have been, we had agreements in place with all of the facilities that as they stepped back down out of critical or intermediate care, that those facilities would take the patients back if we started to fill up. The PPE sharing certainly has occurred. One of the hospitals a little west of us on a call mentioned that they were waiting for some hospital gowns, and I happened to just call her and told her I had 18,000 of them, and we drove a few gowns over to help them get by until their shipment came. But that's the sort of level of cooperation that all of the UP hospitals have displayed throughout this. Next, please. So testing, there's a lot of talk on the news, locally, statewide, nationally, around testing. Early on in this, as we started seeing numbers in the UP, one of the major challenges was the ability to get test results. So you're having all these patients present that were COVID-19 suspects, displaying all of the symptoms. And so you have to treat them like they had COVID-19 until you could get a negative test. And it was taking sort of at the worst 12 to 14 days to get a test processed. It was easy to take the sample. It was more difficult to get the test turned around in a timely manner. Team led by Polly here at the hospital did amazing work with our PCR tool, and spent a couple weeks securing the reagents, and developing and doing the quality control work with the equipment so that we were able to do COVID-19 testing. We do have, I believe this morning, 2,700 test kits, and we are now able to process the more accurate test. The PCR test takes about 6 to 7 hours to run. So we run it up to 3 times a day now on the equipment. So we can process about 125 COVID tests a day here at the hospital. The other, and we process for other hospitals in UP too. The other topic around PPE, there's a lot of discussions out of New York, Detroit, and some other places about PPE. I think we had the luxury of a little bit of advance notice before we saw our first patient in the Upper Peninsula, which I believe was the 22nd of March, with the first critical patient being transferred to Marquette on the 29th of March. So we had some time to really build up our PPE supply, and certainly we look at this daily. And we have a daily command center meeting where we look at the PPE and the burn rate for each individual item and estimate how many days we have on supply. That's for both PPE and medications, specifically the paralytics that are used in the operating room are also some of the same medicine and PPE that's used treating us upper respiratory COVID and COVID suspect patients. So we monitor that daily, and we're in a very strong position. We certainly implemented PPE conservation strategies, keeping your N95 on in the hot zone for longer periods of time than you would have in the past, and masking over top of it with the surgical mask as you switched rooms. Ventilators is another concern I hear from the community, and we certainly made a surge plan early on. We had, I think at the start of this, 72% of all the ventilators in the Upper Peninsula were at Marquette. We did get a shipment from the state to augment that supply, and we have more ventilators than hopefully we'll ever need. The governor's office called me last week, wanted to know if I wanted 100 of the unused ones from New York. We declined, asked them to hold those in reserve. we have plenty of ventilators here in Marquette. So we did, as I mentioned earlier, have designated COVID and COVID suspect patient areas, both through the ED and up on the floor. Patients that were COVID and COVID suspect were placed in negative pressure rooms, which we have scattered throughout the facility, but we actually converted several areas to be negative pressure that weren't negative pressure on the COVID unit, in the operating room. We got a room to neutral because those are all highly positive rooms. And then in the ED, we had a couple negative pressure, but we also turned one in the trauma base into negative pressure. I think it's important to note that in the UP currently, here at Marquette, there's a very low number. I didn't check the emergency management board today, but I believe the admitted number of COVID patients in the UP is now 0. A couple of days ago, we discharged one of our really most critically ill patient that we had seen throughout this long ventilator stay, and then stayed in a rehab unit trying to recover after she was off the vent and no longer COVID positive. She was actually able to walk out of the facility a couple of days ago to the salute and cheers of the staff. So it is a very low number currently in the UP. I believe it to be 0. Next, please. So one of the things that's come out of the COVID response is the recognition that telehealth needs to be a bigger part of both how we operated during this pandemic and probably well after it. So a lot of work has been done around setting up telehealth visits with your providers. We were able to do that through all of our clinics. So you can have a virtual visit with a provider from the safety of your home to protect, again, our staff in the clinics, the providers, and the patients from having to come sit in a waiting room and not know who else might be in the room. So I think you'll see, hopefully, be something that stays part of the healthcare arsenal in a much bigger way than it was, 3 months ago. Next slide, please. So healthcare in the future. This picture, I love this picture. This was probably during the time we had the most COVID patients that we had in the facility. This young patient was here for non-related surgery and was staying on the pediatric unit. And I believe this is the 7th floor, sitting in front of the windows that the staff had decorated. Just kind of, I love this picture because it sort of reminds me that life went on and has to go on, and we have to care for everyone throughout this crisis. But things will look a little different. I can't say what visitor policies will look like in the future as these things sort of unwind. When you come in the facility now, and all the staff are in masks, every clinical area they're wearing masks and face shields and masks and goggles. Again, as we're doing everything we can to protect and make it a safe environment for our staff. But we do have to get back to normal. We've missed a lot of care throughout this on a national level. I think you've seen lots of statistics out about the unexpected deaths in the U.S. far exceed the number of deaths from COVID, from people not seeking health care. We operate the ambulance services here, and they're seeing people that unfortunately didn't call 911 on time and stayed home with chest pain until it was too late. So we're certainly beginning some of the annual screenings for cancer and some of the procedures in the operating room and other places that really help improve physical health and quality of life as we move forward. Next, please. So I don't think we can say enough about all of the people in healthcare and law enforcement and EMS and the grocery store workers and everybody who really was at the front line. So we have a campaign about Thank a Healthcare Worker. We do get amazing emails and cards and drawings and letters sent from the community that are displayed throughout the lobby of the facility. And that really did a lot to build the spirits up of the staff especially early on when we didn't know what we were really dealing with. It was not uncommon to see a ER nurse in full PPE just taking a moment looking at the cards on the wall. So I want to thank the community for keeping the healthcare workers here and everywhere in the UP in mind throughout this. Next slide. So again, if you want to stay in touch, know what's going on here, we certainly post stuff up on Facebook on a regular basis. On our webpage, there are some really uplifting things on our Facebook page. Jerry, patient a couple of weeks ago, being wheeled out of the facility after winning his battle with COVID, and the staff lined the hallways to give him a round of applause. So I encourage you to follow our Facebook page. There's a lot on there. These pictures to the right just sort of demonstrating, how we've spaced out waiting room chairs and the importance of markings on the floor that let you know what 6 feet looks like, and just how the staff has really come together and worked hard throughout this crisis. Next, please. So again, I just want to finish with our mission statement is making communities healthier. And we focus our mission around our vision, which is to create places where people choose to come for healthcare, physicians want to practice, and employees want to work. Thank you.
Thank you very much, Gar. Appreciate that update. And as we continue in particular in economic development, obviously, restarting our economy, reopening our businesses is so critical to their long-term success. However, making sure that people are confident and comfortable doing that, and knowing that there's the healthcare system is there and ready if and when they do confront the virus is so important to all of the recovery process. So thank you for that.
Yeah, thank you. I think it's important to know about what hospital bed capacity is in the Upper Peninsula, because a lot is being stated about we have less people, but we have less hospital beds, which led me to, I had to know, so we ran the numbers off the emergency management system, and the UP per capita has the third most hospital beds of the 8 emergency regions in the state of Michigan.
That's great, and that's so good to know. Again, the factual information, and that's what part of today is all about. Next, we welcome Patrick Jacuzzo. Patrick serves as the Director of Environmental Health and the Public Information Officer for the Marquette County Health Department. Patrick has over 24 years of experience working in public health. Today, he'll be touching on the health department and the COVID-19 in Marquette County. Patrick, I'm guessing you have been crazy busy since this all started, and we're just grateful that you could also be here today to talk with us. So take it away.
Sure, you can go to the next slide. Today, we're going to kind of talk about what the local public health role has been in COVID-19 response, and then also, where the governor is heading with reopening businesses and what some of the guidance that's currently available is for business and where that's located. So with regard to local public health role, they're listed there. We provide guidance and coordination to the medical community through guidance that comes from the Michigan Department of Health and Human Services. We provide interaction and guidance and coordination with long-term care facilities with regard to their prevention and response and testing for COVID-19. We do case contact tracing, and we'll get more into this in a couple slides. That's something that our staff spend quite a significant amount of time doing. You've probably heard about that in the news and that kind of thing. Data management and reporting surrounding cases and contact tracing, guidance and recommendations to patients that have tested positive or that are suspected positive. We've done some coordination of isolation and quarantine housing, some coordination and guidance to shelters, oversight and guidance to business, assisting and coordinating the availability of and distribution of PPE, and assisting and coordinating testing supplies. So we can go to the next slide. So local public health is considered critical infrastructure. So we obviously don't close during the COVID-19 response. We stay active in this response itself in areas previously mentioned, and also in general emergency response roles within the FEMA emergency response structure that comes down through the county. We have 3 clinics, so we do have some acute care clinic services that remain operational. And then in our environmental health services, obviously a lot of those are critical infrastructure. So we still provide services to our food service establishments, drinking water supply regulation, wastewater permitting and oversight and regulation. We interact with the licensing and inspection of the child care centers, foster care homes, and then we're involved with the executive orders that affect things like campgrounds and food service and other services within the community. Next slide. So contact tracing. During contact tracing, our communicable disease nurses are informed of positive cases, and they contact each positive case to determine high-risk exposure contacts. We provide isolation and quarantine directives to each positive case, and we follow them through the course of their illness. And then we interview each high-risk exposure contact with regard to health status and provide isolation or quarantine directives to each of those high-risk exposures. So we go through and try to figure out exactly who everybody's been in close contact with prior to being tested positive. We do follow up with all contacts through the course of isolation and quarantine for status and determine final disposition of that illness. Next slide. So this graphic kind of shows how that works. We get a positive COVID case identified. Our communicable disease nursing staff interviews that specific case, issues an isolation order to the positive case. We'll contact employers of the positive case if they're employed for notification and follow-up interviews. Employers, we want to figure out who may have been a close contact to that individual in the workplace, and then we contact each of those close contacts and quarantine and follow those through for health status. And then of course, just your individual in the personal life outside of work, who their close contacts are, we follow them through as well. So next slide. And as part of that contact tracing of cases, we manage the data that gets filtered up to the Michigan Department of Health and Human Services, that gets reported out, and then it gets up through the state and reported out nationally. So all case information that are tested positive for COVID-19 are reported through the Michigan Disease Surveillance System database, the MDSS database. And then there's a separate database, the Outbreak Management System database, where we place all the high-risk contacts that we're tracing that have not yet been determined to be positive for COVID-19. So if they do at some point become positive, they would be moved over into that other database. And the data from those 2 databases is transferred automatically, electrically to Michigan Department of Health and Human Services. There's also a COVID-19 situational report that has additional demographics that we complete daily and get submitted at 11 o'clock every morning to the Community Health Emergency Coordination Center, which is part of the Michigan Department of Health and Human Services, to provide additional characterization of what the outbreak itself looks like. And then COVID-19 deaths are also reported through local public health. Next slide. So personal protective equipment, we do get involved in that. The current executive orders require businesses to provide masks and customers of some businesses to wear them. The County Emergency Management Division does have a limited supply from the FEMA Strategic National Stockpile that can be accessed through us if you go to the contact that's listed there. And that's kind of a limited supply there. There's also some business resources that were kind of recently released in the last few days that are linked through there, where businesses can source PPE that they may need for their employees. Next slide. Testing supplies, we do have limited numbers of test kits. We have been using those to support long-term care testing and for certain medical providers that may need them. Generally, the test kits that we have are intended to be submitted through the state lab. Our supply source currently is pretty strained by the recent testing that occurred in corrections facilities and long-term care facilities. They used a lot of what was currently available through state avenues. Testing locations throughout the county. There is the Teal Lake facility, which is slated to close, I believe, the 29th. UP Health Systems and Bell, Superior Walk-in Clinic, and then some medical providers that have chosen to do testing. The state's current goal is to expand testing to a capacity of a capable capacity of 30,000 tests per day statewide. So the availability of testing equipment is ramping up and it's there, but we aren't seeing the demand for testing locally as much as they are in other parts of the state. But that may change, if we have a second spike in illness, which we can expect at some point. Next slide. Isolation and quarantine shelters, Marquette County Health Department, and other divisions of Marquette County coordinated with local businesses and some community agencies to arrange some locations and local hotels for isolation and quarantine of cases. There were two types that were arranged. The first being for cases that either tested positive or were recommended to be isolated because they were a high-risk close contact to a positive and they did not have effective housing to isolate or quarantine. So we were able to coordinate with some local hotels to have some housing for these individuals, and then we would coordinate the transportation of these individuals to those locations so that we could track them through the course of their illness. And also we coordinated, the provisions of them and getting that back and forth, because they technically aren't allowed to leave those locations when they're in that isolation or quarantine situation. And then there's also a type that was organized that provides housing assistance to frontline employees like medical employees or first responders that just don't want to go home and potentially expose their families to the illnesses. They can get some assistance in housing with regard to hotel stays and that through that avenue. Next slide, please. And so getting into where the governor is heading with opening the state, we don't really get at the health department a lot of, we don't get any heads up from the governor's office with regard to what is about to come down. Usually we just listen to her press conferences and then, chase the executive orders around. But her Michigan Safe Start plan has been released. It's available for download at that link. It basically provides a general outline of the criteria and framework for the planned phased-in opening approach to various businesses and industries in the state. And it provides specific guidance regarding operational strategies for COVID-19 for specific businesses and industries. So if you go to the next slide, this is kind of a layout of the 6 phases of this Safe Start plan based on the situation with the COVID-19 outbreak. So currently we are in stage 3, which is flattening. And in these scenarios in the Safe Start plan, it lists there kind of what would be allowable and the types of businesses that may open during these different phases. So, and as you're aware, construction, manufacturing, real estate, outdoor work recently opened as we entered into phase 3 here. This can go either way, depending on what happens with the epidemic. So if we get a situation where our rates are rising faster, we could go back towards 1. So that kind of gives you a little bit of a framework of where things are headed with opening of businesses as we move forward. So we would have to be pretty significantly along the line to stage 5 before, for example, restaurants and bars get down to actual indoor seating. I mean, they're still open for curbside pickup and takeout with some restrictions on social distancing and so forth. But as far as being fully open for some of these types of businesses, it looks like we're going to be down the road a little bit on that. Next slide. And with regard to the Safe Start plan, the governor's team, the Michigan Economic Recovery Council, developed these reporting regions based on economic factors. And so the idea is that in certain instances, we may have phased-in approaches that are different between these economic regions, dependent upon what the current disease status is within those given regions. Next slide. So her plan also kind of puts out some general guidance on what is expected within businesses and industry as they open with regard to controlling COVID-19. The first being access control, so implementing best practices to quickly identify and catalog potential introductions of COVID-19 into the workplace. So basically daily symptom screenings, on-site temperature checks, rapid diagnostic testing protocols if applicable, intake procedures for visitors, so basically visitor screening, and guidelines for prevention and delivery areas is access control. Next slide. Social distancing, obviously, within the workplace, so minimizing the levels of close contact within the workplace to limit spread of COVID-19. Remote work standard where possible. Standards for who can work in person, social distancing guidelines within the workplace, restrictions on common instances of non-essential close contact, so maybe adjusting how conference rooms and cafeterias and other common areas in the businesses operate, restrictions on in-person meeting sizes, maybe moving more and staying within virtual meetings as much as possible, physical barriers between workplaces to prevent cross-contamination between work areas of specific employees. Next slide. Sanitation and hygiene, so you'd want to, in the workplace, increase both the frequency and vigor of common cleaning practices, as well as implementing new practices to reduce the amount of time COVID-19 can survive on surfaces. So frequent disinfection and cleaning, exhaust and HVAC kind of options for bringing in more fresh air to areas and ventilating at a higher rate. Availability of hand washing facilities in more locations. Hand sanitation is obviously one of the key and crucial components of COVID-19 prevention. And restrictions on shared tooling and machinery and workspaces as much as possible. Next slide. Personal protective equipment, ensuring all employees have access to PPE to keep them from contracting and transmitting COVID-19. And masks be worn whenever workers cannot consistently maintain a 6 feet separation, gloves as necessary, and face shields as necessary, depending on the type of work and exposure risk for particular employees. Next slide. Contact tracing. Now this gets more, there's been some confusion on this. Contact tracing still will be the role of public health. The guidance here for businesses, just to be aware that you may, as an employer, play a role in contact tracing where, if there was a person that tests positive for COVID-19, you as an employer will be contacted by local public health, and we're going to need assistance in being able to identify who this person may have been in close contact with within your facility. So you're going to want to have some protocols in place to kind of be able to provide that information in case you need to. And investigation standards, facility cleaning and shutdown procedures should you have a positive case or high-risk cases identified as being associated with your facility, and then guidelines with regard to how you as an employer will handle mandatory quarantine and return to work with regard to health department recommendations for those individuals. Next slide. There's multiple workplace specific guidances on our website. The link is there for our return to work strategies portion of our website. We'll kind of cruise through the website a little bit towards the end. The best way to get to our website, and you'll see the link towards the end, is mqthealth.org. But there's specific guidances listed and linked through our website for various businesses. Next slide. This website, the Business Leaders of Michigan, is also a very good resource for business-specific guidance on COVID-19 prevention. We might want to click on this link here to kind of maybe show an example of what that might look like. Can we open that link? So if you page down, under retail store practices, if you click that, I'll give you an example of what kind of materials are available on this website. So if you page down through this document, it's a plan for, in this instance, for retail that kind of runs you through all the different, things you would need to be conscious of and address within your facility for COVID-19. So it's basically almost a pre-written policy that's for that specific business type. So there's several of these on this website. So we can probably check out of here and get back to the slideshow. But that's a really good resource for businesses looking for guidance. The next slide. Can we go? There we go. So with regard to what's currently happening in Michigan, this curve I pulled off the state's website on the 13th, but you can see that the daily confirmed cases are declining. So we are on the downslope in Michigan. And then in the next slide, this kind of gives us a growth rate status projection from COVID Act Now. These are based on modeling estimates, but it shows that we're kind of in the medium growth rate in Marquette County, but on a downslope as well. So I guess the take-home message, next slide, is that we are kind of on the downslope with regard to COVID-19 rates in Michigan and locally, but we want to make sure as we open businesses that we're adhering to strict COVID-19 prevention strategies so that we don't have an uptick. We as rural areas may lag behind the rest of the state, especially as we open up the state and people start traveling around more. And it's also important to note that within the upper Midwest and Minnesota and Wisconsin, there's areas that are seeing the highest national rates of increase in COVID-19 right now. So we kind of are regionally surrounded by some areas that are seeing significant increases. So as we open up our state more and potentially see more traveling to and from these areas, our businesses become key in kind of preventing unnecessary spread in our local region. If you click on that link there, that brings you to the main page of our website. So if you expand that out a little bit, yeah. So if you page down, if you click on current COVID-19 positive cases on there, that will bring you to the state's website, which will give you current case counts daily, and some other various information by county. So all your current information with regard to case counts is linked through there. If you go back to our website, I'll show a couple other things. The governor's orders, if you click the governor's orders link, and then executive orders, this lists all the executive orders here. And if you click on any of those associated links, the entire verbiage for those executive orders and frequently asked questions documents where applicable are available there. So if you're wondering what executive orders are out there, what executive orders specifically say, you can link to those through our website pretty easily. If you go back to our website again, and you click page up a little. Yeah, so if you click COVID-19 information and resources, and page down, this kind of gives you a lot of general guidance, and then what to do. And on the what to do section, it's kind of broken out into different facility types. So if you go to return to work resources at the top of that section, Michigan Start Plan is linked through there. There's guidance for reopening businesses that are linked through there. Specific guidances for food service establishments through industry, and various resources, and your personal protection equipment resources are also listed through there. There's also other employer resources on the previous page that we were on, and different facility resources. Yeah, click COVID-19 information. Yeah, and then you can see through here that there's information for schools, long-term care, travel related, and various different categories. So we tried to make our website so that it was kind of a one-stop shop for, trying to keep up on what particular guidance and situation is with COVID-19. So that is pretty much it for my presentation regarding what the health department is doing here with COVID-19.
Well, thank you very much, Patrick. Obviously, definitely not a dull moment over in your shop managing all of this, and we appreciate it. Just want to remind everybody, we are taking the questions from the questions pane, and you can put those in at any time, and Ashley's collecting those so we have them for the end. The only comment that I also want to throw out, a couple interesting things to me, were the infection rate in Marquette County of infecting 1.18 people for every one that's infected. And we hear the infection rates in other areas or statistics thrown out that, a person is infecting 20, 30, 40 people. That's really interesting to me. And again, when we talk about the confidence in reopening and restarting our economy up here, and hopefully the regional approach to allowing us to do that. Well, a good segue that is to Bob Thomas, and Bob is a widely respected chamber and association executive with over 20 years of experience in the nonprofit industry. He's responsible for the day-to-day operations of the chamber, including facilities, technology, information systems, human resources, and membership development. Bob also assists with strategic planning, financing and accounting, and meetings management. As Executive Director for the Michigan Chamber Foundation, Bob oversees the alignment and direction of its leadership programs, public policy research, and events related to free enterprise, competitiveness, leadership, and entrepreneurship. And apparently he's also the PPE guru added to that list. And so we are just grateful that you are able to be here with us, Bob. Take it away.
Thanks, Amy. I really appreciate being here. I hope what I have to offer is a little bit more detail of what the previous two speakers offered. There's probably some overlap here, so just a heads up. The Michigan Chamber got involved in starting to provide PPE resources to businesses when we started to hear about what the reopening plans looked like, and recognizing that there was a shortage in a lot of these items. We wanted to give businesses in the state as much lead time as possible to start thinking about what they were going to require for their own operations, and then what sorts of guidance they could get in order to place those orders. So PPE equipment was defined as equipment worn to minimize the exposure to hazards that cause serious workplace injuries and illness. It's not a new term. It's something that many industries have been employing for a long period of time that OSHA requires. Next slide, please. According to OSHA, what the Act from 1970 requires is that every employer is supposed to furnish all of its employees who are employed a safe workplace, which includes all of that equipment that's required in order to operate safely and within health standards that were dictated under the Act, which also include infectious disease. Next slide. So the employer responsibility here under the COVID orders that we're required to determine what PPE is needed for a worker's specific job duties. And as Pat had mentioned earlier, the business leaders from Michigan did a nice job of outlining what those individual industry sectors might look like. You can also go to the OSHA and CDC websites to get some additional guidance about low risk, medium risk, and high risk, which we'll talk about a little bit here too. But it's not an organization-wide PPE order. You will have to look at what individual job responsibilities require certain types of PPE. And then you also need to provide that PPE at no cost to the employee. So it's not something that they're expected to purchase on their own or as part of a condition for employment, something the employer is required. And then you're also required to provide the training. I just want to make a note here that the homemade cloth coverings that most people are purchasing right now are not considered PPE according to OSHA and CDC, especially for higher risk environments, mostly in healthcare. And while they may prevent workers don't know they have the virus from spreading it to others, it may not protect them from contracting it. So I just want to make sure everybody's clear about the face masks, that there are definitely differences in the types of face masks that are available. But in most cases, the cloth masks would be appropriate for low risk situations, but definitely not for high interaction with lots of people. Next slide, please. So employers are responsible for making sure that that PPE equipment is distributed when employees are checking in at the beginning or the entrance of the building, and that they should be making sure they keep a 30-day stock on hand so that they don't run out and aren't forced to shut down or delay operations. They need to provide the guidance for PPE, how to put it on, how to take it off, how to dispose of it, how to sanitize it. These are all responsibilities for the employer. They also need to, as mentioned before, define those protocols for case monitoring in the case that somebody was infected. Mark off and clean spaces identified in workplace tracing, which include common use equipment like copy machines, microwaves, elevator pads, etc. And then provide that guidance to exposed employees to make sure that they're also cleaning and sanitizing those areas and that they're aware of what their risk levels are. Next slide. So what PPE do you need as an employer? These are all dependent upon the hazard to the worker and what kind of exposure they might have to infected individuals, knowingly or unknowingly. They need to be properly fitted and periodically refitted as applicable. So particularly for manufacturing or some of those other items that require respirators, they need to be fitted regularly. And sometimes they won't fit right at all. They need to be consistently and properly worn when required, which means that there's a level of enforcement there on the employer's behalf. And then they need to also be inspected, maintained, and replaced as necessary at the employer's expense. And then they also need to be removed, cleaned, and stored or disposed of to avoid contamination with other employees in the workplace. Next slide. So when you select PPE, some of the factors that the OSHA and CDC require or consider are the function, the fit, and your ability to contaminate, decontaminate, and also get the cost. Something that employers might want to take a look at when they're looking at costs is investing in some higher quality equipment that can be sanitized rather than looking at stuff that needs to be disposed of. That could be a cost savings measure long term. That depends on your level of comfort, certainly in sanitizing and taking on that liability. And that each employer should select the combination of PPE that protects workers specific to your workplace. So just because there's an exhaustive list of things that you should consider does not mean that they all apply to all of the things for your workplace. Next slide. So I'm going to run through a couple of scenarios based on guidance from OSHA, and there's a guide that's linked at the end of my presentation that you could go to get some of these specific items, and then BLM also borrowed all of those items for their industry-specific reopening strategies. A lower exposure risk is for kind of general office situations, probably where there's low contact with anybody from the general public, and probably low contact with other employees, provided that you can re-engineer some of their work processes. So in all of these scenarios, employers are required to put together a preparedness response plan, and that's something that's indicated by the executive order from the state, from the governor currently. And part of that plan requires you to re-engineer any of your processes before coming back to work, which means promoting telework as possible, social distancing, staging multiple groups of employees over a period of time, re-engineering your processes to become low touch or virtual, and looking at delivery or curbside options if you're in a retail environment. You need to look at promoting administrative controls, which include hand washing, respiratory etiquette, which is like sneezing into your sleeve, for example. But in these particular situations, no additional PPE is required according to OSHA or the CDC. So a cloth mask would be sufficient, provided that you're also doing regular sanitization of your general office areas and regular cleaning to protect employees. Next slide. A medium exposure risk is probably consistent with a lot of the companies that are looking to open right now, including restaurants. They require contact with people infected in periods of within 6 feet of a potentially infected individual. They have frequent contact with other workers and the general public. So this is probably your restaurants, retail, customer service segments, places where you need to meet with people regularly. In this case, again, your preparedness response plan, but then also required our installation of physical barriers, the testing and monitoring of employees more regularly, face masks or face shields or a combination of both, gloves, gowns, and goggles, depending on what their interaction are with those particular populations. Next slide. So for high and very high exposure risk, these tend to be healthcare workers, mortuary or funeral directors, folks who are in regular contact with knowingly infected individuals. Again, these employers are required to have a preparedness response plan, include isolation rooms, enhanced testing and monitoring of workers, face masks with respirators and or face shields. So these are the higher quality PPE requirements that are in short supply and should be reserved for high risk employers. So if you're a low risk or medium risk operation, those are items that should be redistributed to higher risk companies. And then they also have to have plans for disposable or sanitization of PPE. So more likely, they're likely to remove these items from their workplace. Next slide. So if you're looking also to manufacture PPE, perhaps you're a business that's able to pivot some of your operations and you can help supply these items to other businesses that are in need. Here are a couple of resources that might be helpful for you to take a look at. There's actual specifications at the Right Place, which is an organization out of West Michigan, for manufacturing these particular items, which include gowns, masks, gloves, ventilators, sanitizer, wipes, goggles, face shields, and testing swabs. So if you're able to be in this space, this is in high demand right now, and there are actual specs there for how you could reconfigure some of your manufacturing operations to handle that. Of course, they all need to be approved by the Food and Drug Administration, and there's a link there too for more information about that. Next slide. So if you're not able to manufacture your own, where you can purchase it, Pure Michigan Business Connect out of the Michigan Economic Development Corporation has a pretty robust slide of businesses that are able to supply this, but they tend to be in larger quantities. It's not really helpful for small business, but it is a resource that perhaps they could take aggregate orders. The Michigan Chamber of Commerce has a directory open to the public that includes Michigan-based businesses and others that have paid for access to the directory, but it's open to the public and you can link on any of those, and they also take aggregate orders. And then check with your local chambers or economic development groups, including the Lake Superior Community Partnership, if there are any local resources of folks who can source, distribute, or manufacture that product. And this includes face shields, masks, sanitizer, gloves and gowns, testing services. The Michigan Chamber's PPE directory is including a couple of new categories, including decontamination services, sanitizing services, low-touch solutions, signage and printing to help people recognize social distancing, and ways to brand some of this in the event that we'll need to do this for long term. Next slide. Here are all the sources for the information that we have. Rather than trying to recreate information, we're going right to the source from the Centers for Disease Control, OSHA, the Department of Labor and Economic Opportunity, and then Michigan's coronavirus website that's got a toolkit for all of this information. I would refer any business to go directly to those sites, what's required for your type of business, and then work with your legal counsel or HR assistants to try and navigate that and reduce your liability. One additional note, the Michigan MIOSHA program also has a grant available for businesses for matching up to $5 in your purchases for PPE. So you can basically double your purchasing power with that grant from MIOSHA. That's for companies with less than 250 employees. So just another good resource for smaller businesses. And that concludes my presentation.
Great, and it's very helpful. And the information on that particular grant program is on our website as well. Great opportunity to get some matching funds, because obviously this is another expense to the bottom line for businesses as we begin to reopen. And now I'd like to welcome our last panelist, Julie Greffe. Julie is client principal at Manpower in Southwest Michigan. She has worked for Manpower for 4 years. Prior to working at Manpower, she worked at medical sales and operations for 15 years in the Chicagoland area. Julie is a mom of 2, coaches in her free time, and is currently pursuing an MBA. Before I turn it over to Julie to talk about employer requirements and our business restart, I also want to thank Brianne Farr. Brianne is at our local Manpower office in Marquette, one of our go-to all the time, but she was also instrumental in getting Julie here with us today. So we really appreciate those folks and all they do for us here in Marquette County. So Julie, I turn it over to you.
Thank you so much. I appreciate that. Manpower has started a work ready program to help the clients that they're working with get ready to either keep people working or start bringing them back. So if you can go to the next slide, please. This is just our official disclaimer. The presentation that you're about to witness should not be relied upon or constructed as legal, financial, or medical advice. The law is changing literally every single day and can vary from state to state and even city to city. Please consult with your own legal, HR, and finance resources and consider state and local law variations before making any policy or procedure changes. Next slide, please. What does Work Ready consist of? Now, in the last two conversations we've heard, both from Patrick and Bob, there's going to be a lot of information that's going to be relayed in this that's the same. To be honest with you, I'm going to take that as a compliment that Manpower and the clients we're working with are on the right track. If you could go to the next page, please. We are hearing a lot of different questions and concerns from our current clients. Some are making changes, some are not. The biggest concerns include safety practices, candidates who are receiving unemployment or stimulus support that are not rushing back to work, and then of course the status of their recovery plans. In the last week of April, we put together a survey to ask 6 basic questions of how our companies are planning for recovery post-COVID-19. From that, we learned that 68% of companies who responded have either not finalized their recovery plans yet or have not even started to build one. This is how Manpower can help. Next slide, please. As we've already heard, Governor Whitmer has a Michigan Safe Start plan that currently outlines 5 main areas, which are access control, social distancing, sanitation and hygiene, PPE, and contract tracing and isolation. Manpower is working with numerous companies across the country to navigate all of these particular categories. Next slide, please. Bringing people back to work isn't as easy as just turning on the lights. We have watched complex legislation govern how companies could maintain operations. The same is true for reopening. The recovery plan is going to be critical to ensure that you're ready to reopen safely and meet the required guidelines. This is how Manpower has developed the Manpower Work Ready program, putting safety first with updated health and safety protocols, enhanced safety training, and simple health checks. Next slide, please. Safety is priority number 1 for our employees. Based on feedback from companies, we know that safety will be a critical factor in workers deciding to continue working or returning to work. Manpower's Work Ready leverage our deep expertise in worksite safety and best practices for maintaining a healthy workplace. Our enhanced training increases employees' knowledge and self-awareness. Worksite assessments and health protocols leverage updated tools to validate safety practices and assess risk, and our wellness screenings ensure a proactive plan to keep our team safe. So let's take a look and we'll share the components of Manpower's Work Ready program. Next page, please. Okay, so we've taken several measures to increase communication with our workers. Our goal is to ensure people have the confidence that we're putting their health first. Here are just a few of our tools. The first is a new office guidelines to communicate clear instructions about expectations, health monitoring, and worksite safety plans. We've customized some training to address critical healthcare topics of today, such as social distancing and hand washing, and then health checks conducted on a regular interval with our associates that we're placing in the workplace. Next slide, please. Like many of you, safety is part of Manpower's DNA. Some great safety practices in place, but COVID-19 has made us view things differently, and we saw an opportunity to update our practices based on new lessons learned. We're assessing our work sites through updated lens, which includes health monitoring, social distancing, PPE, hygiene and sanitation, case management when illness impacts the workplace, and then communicating to our associates properly. We updated our work environment surveys and our protocols to assess different types of risks in the workplace. Let's take a look at some of these items. Next slide, please. So assessing your workplace. We took a few of the questions and asked ourselves and our clients what they're looking for. Based on the results, we identified a site as low, medium, or high risk and applied updated safety standards accordingly. Kind of saw something similar in the last presentation. Next slide, please. We assess risk at the worksite level, but also specific roles within the worksite. So a specific site may be considered high risk, but because of the particular position they have and the exposure, that the associate has, their job may not be considered necessarily high risk. Next slide, please. Critical recovery plan components include facility planning, health checks and monitoring, communication and case management, sanitation and hygiene, and then proper PPE. Next slide, please. Looking at facility planning, all sites should have safety posters, hygiene reminders, marked floors, and physical barriers. Low-risk facilities should include removing certain furnitures, relocating seating, and then staggering meal breaks. Medium risk have dedicated space, limited share facilities, marked floors by a line, by worker, monitoring social distancing, reduced visitor access, increased time clocks, and then possibly staggering start and end times. And then of course, high risk will have all of the previous, but then limit the shift size, increase your PPE, easy access to supplies, review your sick pay policy to encourage associates or employees who are ill to stay home, reduce or eliminate any other visitors, and then possibly consider one-way traffic or flow. Another area that you might want to consider too is looking at the tools that are used within your workplace. A simple shared pen can be a way to share COVID as well. Next slide. Health checks and monitoring. All sites should be implementing some type of health questionnaire and communicate self-monitoring. Low-risk sites should include employment health checks and possibly pre-arrival temperature screening. Medium risk, weekly health checks, pre-arrival health check and temperature screening. High risk, daily health checks, temperature screening, infrared scanning, on-site nurses. Some clients are using the infrared scans. They're using a walk-up TV screen and get a notification as you walk through the security desk. This reinforces the safety and provides reassurance while all completing that important health check. We've also seen some clients that have purchased thermometers for all of their employees to take a temperature prior to even leaving for work that day. Next slide, please. Temperature screening. Solutions are twofold. You need to think about who and determine if you'll upskill someone on your team or supplement with trained resources. You also need to think about how to ensure you have the procedures, processes, and tools in place. We've seen companies solve both ways. Some have the team and expertise, and others choose to buy the team and expertise to install in a work-ready solution. Next slide, please. Work-ready health survey administrations. We've also seen companies handle health surveys and checks in very unique ways. Some are handling this on-site, others are checking in virtually, capturing health data remotely, and using tools or technology to manage health surveys efficiently. Here in Michigan, daily symptom diaries, on-site temperature checks, rapid diagnostic testing protocols, intake procedures for visitors, and guidelines for delivery areas. Once again, we have seen many different situations or unique techniques involved to certain clients setting up triage systems. So if they do have an associate that has certain symptoms, they are bringing them into a particular area and putting them on the phone right away with a telehealth professional. Next slide, please. Sanitation and hygiene. All risk levels should have safety and hygiene reminders posted throughout the workplace. Proactive steps to ensure social distancing, tape on the floors, physical barriers. Low risk, permit hand washing breaks as needed. Daily cleaning regimen for facility, supply workers with disinfecting wipes and or spray for workstations. Medium risk, permit hand washing breaks every hour. Clean and disinfect the workstations during or between each shift. And then high risk, premium hand washing breaks every 30 to 60 minutes. Procure additional equipment or tools to reduce sharing, and then clean and disinfect the workstations throughout the shift. We've also seen several areas where they've put grids in place where employees are not allowed to work outside of their particular department, where previously we were rotating to protect on an ergonomical level, but now they want to make sure that people are not cross-contaminating in different lines. Next slide, please. Work-ready sanitation services. Every company must have or begin implementing some version of cleaning protocol. But is it enough under these circumstances? Do you have the right people and the right processes? Should you supplement with additional people, with audits, with checklists, or new supplies? In some states, 2 or more positive cases in a workplace can equal an outbreak. Next slide, please. Obviously we've heard earlier that PPE is a hot topic and a concern for many procurement managers. Do they have what we need in order to maintain business levels? Do we have enough? Do we really know what we need? That's an area that Manpower can absolutely help you with. Next slide, please. Communication and case management. We've talked a lot about being proactive, but how do we prepare to react if faced with a positive case in the workplace? All risk levels should have a plan for managing positive or presumed positive cases. Communication plan for a positive employee, documentation of recent contacts, plan to contact and communicate potential exposure, and regular check-ins with positive employees. Low-risk communication templates can be created to prepare for potential exposure. High-risk mass communication tool plan for cluster or positive cases, distribution lists created, tools ready to go with messaging templates, emergency procedures in place for facilities management. Next slide, please. 8 weeks ago, how many of us were really talking about contract tracers? Probably those of you that work in the healthcare field may have already been using that term, but for the rest of us, it's a new world. Fast forward to case management has become one of the key protocols needed for companies to reopen. Contact tracing is the new service industry. What a great opportunity to redeploy those who have been displaced, as so many traditional service roles have disappeared. Contact tracers will help identify and document potential contact on exposure, communicate and connect, and follow up through testing, care, quarantine, and returning to work. Next slide, please. There are 3 things every employer should keep in mind. Number 1, ensuring you have the systems, processes, and equipment you need to keep people safe. This includes work and shift planning, alternative teams on different days, clear policies for social distancing in the workplace, increased cleaning, no in-person group meetings. Number 2 is providing people with the confidence you are putting their health first. People aren't going to come back to work if they don't feel safe. Communication is key to ensure employees and customers feel comfortable being in your business when restrictions are lifted. Share what you are doing to ensure distancing is respected. Number 3, remember that today, more than ever, are front and center. The way work gets done has had to shift to accommodate kids out of school and family members needingly living one life at one time. As an employer, remember that child care plays a that hinders us from returning to work. Employers need to recognize this and be accommodating to employees as business plans reopen when guidelines are relaxed. Take into consideration staggering shifts and offering more flexibility for people to work around their family. I know that I had no idea 2 months ago that I would be, well, probably 2.5 months ago now, that I would be homeschooling my children consistently through the end of the school year. So that has definitely made a big change in my particular life. Next slide, please. Thank you guys for including Manpower today. We, like all of you, have been working during this pandemic in our kitchens, dining rooms, and bedrooms. Just know that no matter where we sit, when you call us and need us, we are still answering the phone to service you. Thank you again for your time.
Thank you very much. What's great information. I look as with a lot of businesses preparing to start, and I think this type of information is really important, since for a lot of businesses, they don't have what a full restart date looks like. So they have no control over that in some sense. They do have control over how they begin to prepare their workforce, their workspace, those types of things. So I think these are things that, you know, are actionable that business owners and employers can work on today. We do have time for a couple questions, and rest assured that any questions we don't get to, we will get the answer and get them back to you for sure after this. And we will also share the recording and the slides from today. They'll be sent to you with just a short survey about today's webinar, as well as put on our website in case you want to review anything, or if there's others that weren't able to join us today. I kind of have a question for all of you, if anybody wants to jump in, but listening to all the presentations today, and as we talk about testing and tracing, it seems to me that, you know, how important is that, or what does that look like for resuming normalcy in as we're going to know it from your perspective? It seems like it is a key to being able to move forward. Can anybody comment on that?
This is Patrick. I think really the expanded testing is important in characterizing the outbreak itself. You know, the previous testing was limited to the highest risk populations and the most ill individuals. So the true nature of what the epidemic looks like is hard to characterize without expanded testing. But with regard to what those testing outcomes, especially when you get into antigen testing, really mean, that's still up in the air, because nobody really knows whether or not, having a positive antigen test confers any kind of immunity, and if it does, how long that would last, and whether or not it would convey over to other strains. So I think really at this point, the expanded testing is really more about understanding how the epidemic is moving through our communities.
Okay, great, thank you.
Anybody? I can add, this is Gar. I can add just a little bit about the fact now that we're as we're doing surgeries and other procedures are testing asymptomatic workers. I think it's going to help to understand the epidemiology a little bit more, because heretofore we were only testing people that were symptomatic. Some of the numbers that we found here is we were testing patients presented in the emergency room or transferred for other facilities displaying COVID-like symptoms that we tested. And again, we're using the most accurate, the PCR test. I think there was stuff today about the Abbott quick test might have a 50% false negative rate. So we've really maintained using the PCR test. But we had automatic patients that got admitted and got tested. We had an over 98% negative return on those patients. So that helps a little bit with understanding a little of that epidemiology, but I think we'll learn a lot more as we're now testing, essentially hundreds of surgical patients in the next several weeks to get an idea of what the spread might be amongst asymptomatic people.
Great, that's a really good point. And Gar, while I have you unmuted, a question directed for you is, what advice would you have for mandatory temperature checks at businesses? Is this a good mitigation strategy or not if so many people are asymptomatic? In addition, should businesses be creating plans to purchase COVID-19 tests to test employees?
So the first part of that question, I'm going to kick to let our friends from the health department talk about if they want. But on the second part about purchasing test kits, that's still to be seen what you would do with those test kits. One of the big limiting factors is not the number of test kits. I'll go back to some of the numbers I gave during my presentation. I have 2,700 test kits today. I can process in my lab about 125 tests a day. So, everybody having test kits, and also the difficulty of obtaining an accurate swab. Maybe the health department thinks differently. I find it hard to imagine that we'll be testing, individual businesses will be conducting their own tests on employers. And again, I think we have to be careful with some of these quick tests that have come out. I literally saw a report today that those have an up to 50% problem around sensitivity given wrong negatives. So I think there's a lot of work still to be done around testing.
Okay, great. Patrick?
Well, I don't think that, there will be any specific recommendation for employers on a grand scale to be doing testing themselves. And with regard to temperature screening, it's recommended for everyone that you do health screening. For the lower risk areas, those temperature checks can be done by the employees prior to reporting to work, as long as they're honest, via the honor system. With regard to, mandatory temperature checks by the employer, I think that's something that would be more recommended towards your higher risk employment situations.
Okay, great, thank you. Bob, a question for you. You talked a little bit about the preparedness plan requirement, and I think there's been some confusion by businesses that is a requirement for everybody in the reopening, correct? And what does that look like?
It is correct, and we've got some webinars on our website from the Bodman firm that outline what that response plan might look like for each of those 4 categories. So before any business reopens, they should have that on file and ready to communicate with their employees, and then anybody that they would come in contact with as it relates to what their mitigation plans are or for contact tracing. So there's some templates there for businesses to download and modify or customize for their own business.
Great, and just when you say file, that is just filed in your current workspace, not at the state level, correct?
Correct, yeah, so it's just to make sure that you have it on hand in case that you need to refer back to it about what plans that you did put in place, what policies you did have in place to reduce any potential liability or harm that might come from a lawsuit.
Okay, great. I think we probably have time for one last question that I'll throw out for Julie. As you talk about, preparedness with the PPE, what if employees want to, I know you have, but what if employees want to use their own or wear their own? What would be your recommendation on that?
It would depend on the work site, to be honest with you. In many situations, if an employee wanted to wear, say, a cloth mask, even though it's not recommended, my concern would come in what type of machinery is around, could the ties get caught, those particular areas. So to be honest with you, I'm not sure I can give you a solid answer on that. It would be a case-by-case basis.
Okay, well, that's fair enough. That's a good point for folks as they deal with probably that question coming up. I hate to cut this great discussion off, but I want to be mindful of everybody's time. A thank you to Gar, Bob, Patrick, and Julie, and thank you to everyone for attending today's webinar, Health in Your Business. If you have any other questions, please let the Lake Superior Community Partnership know, and as I said, we will make sure we get answers to the questions we didn't get to today. I mentioned the follow-up email with the slides and the webinar link. And I also just want to let you know that we will be having another webinar next week, and one of the focuses of that will be the WorkShare program, which will be very important financially for businesses bringing back employees and a way to split that cost with the current state and federal programs that are out there. So it's Friday. I know we don't necessarily know what day it is every day necessarily, but please be safe and have a great day and a great weekend. And again, thank you for your time.